Have you ever wondered if your child's asthma treatment plan is truly the best for them? I'm Dr. Mona Amin, a board-certified pediatrician and mom, and today I'm breaking down must-know asthma treatment tips to help you feel confident managing your child's asthma. Before you watch this video, make sure to watch my video last week about asthma and the diagnosis of asthma and common misconceptions. And if you're new here, be sure to subscribe so you don't miss out on more expert-backed tips to navigate your child's health, development, and behavior. Let's get to it. Asthma treatment isn't one size fits all. It depends on your child's symptoms, triggers, and severity. The goal? Keep symptoms under control, prevent flare-ups, and help your child live a full and active life without relying on emergency medications all the time. Doctors figure out the best treatment plan by monitoring how often your child needs their rescue inhaler and using tests like spirometry, a lung function test. If asthma is well controlled, your child should be able to keep up with friends, play sports, and sleep through the night without frequent symptoms. Before reaching for medication, there are important steps you can take to reduce asthma triggers and improve your child's breathing environment. These changes can help decrease the frequency and severity of symptoms. Improve indoor air quality. Use HEPA air purifiers, keep windows closed during high pollen seasons, and avoid strong odors like perfumes or air fresheners. Control allergens. Wash bedding in hot water weekly, use dust mite-proof pillow and mattress covers, and vacuum frequently with a HEPA filter vacuum. Avoid smoke exposure. Secondhand and thirdhand smoke are major asthma triggers. No smoking indoors, in cars, or around your child. Pet considerations. If pets are a trigger, keep them out of bedrooms and consider bathing them regularly to reduce dander. Manage humidity. High humidity can actually lead to more problems, especially for people sensitive to mold or dust mites. And also dry air can irritate airways. Aim for indoor humidity around 30%, but try not to go over 50%. Recognize and adjust for exercise triggers. If exercise triggers symptoms, ensure a warm-up routine, avoid outdoor activity during high pollen or pollution days, and consider wearing a scarf in cold weather to warm the air before breathing in. In some cases, using a rescue inhaler 15 minutes before exercise can be the management for exercise-induced asthma. By taking these preventative measures, you may reduce the need for medication or help it work more effectively. Now let's discuss short-term relief or rescue inhalers. When an asthma flare-up hits, rescue inhalers come to the rescue. Short-acting beta-agonists, or SABAs like Albuterol, are the fast-acting heroes that open up the airways and make breathing easier. Think of them like a reset button for tight airways. And how do these work? Rescue inhalers work by relaxing the smooth muscles around the airways, which become tight during an asthma attack. This relaxation allows the airways to widen, making it easier to breathe. These medications start working within minutes and can last 3 to 6 hours. And when should your child use their rescue inhaler? Well, that's going to be the management of your clinician and follow their guidance. But wheezing, coughing, or struggling to breathe before exercise if they have exercise-induced asthma, or if the doctor recommends preemptive use for triggers like cold air allergens or colds. Signs your child might need their inhaler more often: frequent night coughing or waking up due to breathing issues, getting tired more quickly during playtime, needing their inhaler more than twice a week. This signals that asthma may not be well controlled. Common side effects of albuterol or short-acting beta-agonists include mild shakiness, a racing heart, or dizziness, but these are temporary and harmless. However, some children experience increased heart rate or jitteriness, which can feel very uncomfortable. If your child experiences significant side effects from albuterol, their doctor may consider alternative medications such as levoalbuterol or Xopenex. Levoalbuterol is a similar rescue medication, but is sometimes better tolerated in children who are sensitive to the side effects of albuterol. And remember, if you're liking these tips already, hit the subscribe button so you don't miss more ways to keep your child healthy. Now let's discuss long-term asthma management. Managing asthma isn't just about treating flare-ups. It's about preventing them from happening in the first place. That's where long-term control medications come in. These help keep inflammation in check so symptoms don't spiral out of control. One of the most common long-term treatments is inhaled corticosteroids like fluticasone, Flovent, or budesonide, Pulmicort. These work by reducing inflammation in the airways, preventing chronic symptoms before they even start. Some parents worry about side effects like hoarseness, mild throat irritation, or thrush, which is a fungal infection of the mouth. But these can usually be avoided by having your child rinse their mouth after each use. If you're worried about long-term steroid use, it's important to understand why they are actually better for your child's lungs than relying too often on a rescue inhaler like albuterol or frequent bursts of steroids like prednisolone. Rescue inhalers treat symptoms but don't address the underlying inflammation that causes asthma attacks. If a child frequently needs albuterol, it means their airways are constantly irritated and inflamed. Over time, this chronic inflammation can cause long-term lung damage and make asthma harder to control. By contrast, inhaled corticosteroids work to prevent inflammation in the first place. Keeping airways calm so your child has fewer flare-ups, needs their rescue inhaler less often, and can breathe more easily every day. When asthma is well controlled with long-term medication, kids have fewer ER visits, fewer missed school days, and better lung health in the long run. Another option is long-acting beta-agonists, or LABAs, such as salmeterol, Advair, and formoterol, Sympacort. These help relax airway muscles for extended relief. But here's the key. You should talk to your child's clinician if these medications need to be paired with an inhaled corticosteroid. Some kids may experience a faster heart rate or a bit of shakiness, but these side effects are usually mild. Other medications used in management include leukotriene receptor antagonists like montelukast or Singular. These help block inflammatory chemicals in the airway. Most kids tolerate them well, but some may experience mild headaches or stomach pain. Very rarely there can be mood changes or sleep disturbances, so keeping an eye on your child's reaction is important. And then there are systemic steroids like prednisone or prednisolone, which are used only for asthma flare-ups. These work fast to reduce inflammation but come with potential side effects like weight gain, mood changes, and elevated blood pressure. They're not for everyday use, but in certain situations, they can be life-saving. And if we see a child with frequent use of prednisolone or prednisone, along with the rescue inhaler, we're going to have conversations on if it's best to introduce an inhaled corticosteroid, because the benefit of an inhaled corticosteroid outweighs the repetitive risk of using prednisone or steroids over and over every month. If your child is on an inhaled corticosteroid or is needing their rescue inhaler, such as albuterol, more frequently, it's really important to check in with their clinician. In general, we like visits every 3 to 6 months with our asthmatics to ensure your treatment is working effectively and we don't need to scale up or scale down treatment. And if you ever have concerns, don't hesitate to ask, because keeping asthma under control means keeping your child breathing easy and life more manageable for you. When it comes to asthma medications, many parents have concerns, and so let's clear up some common misconceptions and questions. Misconception: nebulizers work better than inhalers. Reality: nebulizers and inhalers deliver the same medication, but inhalers with spacers are often just as effective, if not better, for quick relief. Nebulizers may feel stronger because they take longer to administer and add moisture, but they aren't necessarily more effective. Another misconception: steroids for asthma will stunt my child's growth. Research shows that inhaled corticosteroids have minimal impact on growth, and the benefits of keeping asthma under control far outweigh any potential risk. Another misconception: if my child isn't wheezing, they don't need their controller medication. Inhaled corticosteroids work preventatively, reducing inflammation before symptoms even start. Stopping medication just because symptoms improve can lead to worsening asthma over time. How do I know if my child's asthma is well controlled? If they can play without getting winded, sleep through the night without coughing or needing their rescue inhaler, and don't need their rescue inhaler more than a few times a week, their asthma is likely well controlled. If not, their treatment plan may need adjusting. Will my child always need an inhaler? Not necessarily. Some kids outgrow symptoms, while others manage asthma long-term with medication and lifestyle adjustments. The goal is asthma control, which can mean fewer or no symptoms over time. Should I get an air purifier for my child's room? It depends on their triggers. If dust mites, pollen, or pet dander set off their symptoms, a HEPA air purifier may help. This can be discussed with your asthma management specialist. Using an inhaler the right way is crucial, because if the medication doesn't reach the lungs, it won't work properly. Shake the inhaler like shaking salad dressing. Attach a spacer. This ensures the medicine reaches the lungs instead of getting stuck in the mouth. Have your child exhale fully before taking a slow, deep breath in while pressing the inhaler. Have them hold their breath for 5 to 10 seconds before exhaling. If using inhaled steroids, rinse their mouth after to prevent thrush. For younger kids, a spacer with a mask makes inhaler use much easier. Teaching proper inhaler technique is one of the best ways to keep asthma under control, so practice makes perfect. And remember, oftentimes your child's clinician's office or the allergist or pulmonologist's office should have someone who can walk you through how to teach them how to use their inhaler. Think of an asthma action plan like a playbook. It helps you and your child know exactly what to do based on how they're feeling. No more second guessing or wondering, is this serious? When do I have to give this med? When do I stop this med? You'll have a clear guide for every situation. These plans are broken into 3 easy to follow zones, just like a traffic light. The green zone: The child has no symptoms, breathing is normal, you're going to keep taking the daily medications as prescribed by your asthma specialist. Yellow zone, mild wheezing, coughing, or waking up at night, you're going to adjust medications as per the action plan. Red zone, struggling to breathe, ribs pulling in and out, lips turning blue, use a rescue inhaler and seek emergency care. In my opinion, action plans are useful for eczema too, so if your child has eczema, make sure to ask your clinician for one as well. Studies show that kids who have an asthma action plan have fewer hospital visits, better symptom control, and miss less school, so it's totally worth working with your doctor to create and update one regularly. This is why those visits every 3 to 6 months are so useful, because every child with asthma is a unique child. And if you haven't already, hit that subscribe button so you don't miss out on more tips like this in future videos. Asthma flare-ups can escalate fast, so knowing the warning signs is crucial. Persistent wheezing or coughing, rapid breathing, shortness of breath, chest tightness or discomfort, nasal flaring, or ribs pulling in while breathing. The first step is to use their rescue inhaler immediately. If symptoms don't improve within 20 minutes or breathing worsens, seek emergency medical care. When to call 911. Lips or nails turning blue or gray, struggling to speak full sentences, using chest muscles to help them breathe. When it comes to asthma, trust your gut and trust the child in front of you. If something doesn't seem right, don't wait. Get help. If your child's asthma feels like a never-ending battle, it might be time to bring in a specialist. A pulmonologist, lung expert, or allergist, allergy and immune system expert, can help get things under control, especially if your child is having frequent asthma attacks, needs multiple medications just to keep symptoms in check, or has had ER visits or hospital stays because of their asthma. These specialists can run advanced tests, pinpoint specific triggers, especially in allergists, and explore different treatment options to make sure your child can breathe easier and live their best, most active life. If asthma is running the show, a specialist might be just what your child needs to take back control. Managing asthma isn't just about treating symptoms, it's about prevention and control. Know the difference between rescue versus controller meds. Use inhalers correctly for maximum effectiveness. Follow an asthma action plan to stay ahead of symptoms, and if you do not have one, ask your clinician to make one with you. And don't ignore frequent inhaler use, like frequent use of Albuterol or frequent steroid use. Sometimes children will hop around to different clinics or urgent cares and get steroid, and their main doctor may not know that they're having flare-ups. So it's really important that if you have received any steroids like prednisolone, prednisone, are using a rescue inhaler frequently in between your well checkups, that you bring this up to your child's clinician so they can determine if their asthma treatment plan needs to be adjusted. I'm curious, what has been your biggest challenge in managing your child's asthma? Drop a comment below, and remember, I have a team of medical professionals, including myself, answering questions. And if this video helped, make sure to hit that thumbs up sign, share, and make sure to subscribe for more expert tips. Stay informed, stay empowered, and I'll see you all next time.